We're going to review nitroglycerin, Levophed, and normal saline for the Alaris pump. First, we're going to start with nitroglycerin, and this will be we're just taking under the assumption that it is a standard concentration for nitro. If it is not, then what you'll have to do is go in and actually use the guardrails to change your concentration. Select your channel, go to guardrail drugs. You're going to have to hit in and then kind of page down. You're going to find nitroglycerin. Should be second from the top. And again, it gives you the standard concentration dose here, which is what the hospital's generally going to carry. Hit confirm for the green screen. Go back, check, make sure your concentration is right. Now, note of warning: if what you are seeing for your concentration is not the same as what you have displayed on the pump, you're going to have to manually create this infusion. Alright, so I have put in 10 mics and my volume in my container, and I have hit start, and it should take off without any problem. Now if you need to go in and change your medication, then you would hit channel and actually go in. It'll pull back up what your actual dosing is, and you would then go in and modify your nitroglycerin drip up or down, however you need to do. Obviously you would hit start. The next drug we're going to talk about is going to be Levophed or norepinephrine. You're going to find it through the guardrail system. Go through your menu, through your alphabet menu, and find N and find norepinephrine. Now you have multiple different concentrations. I'm going to select 16 mics in ml, which is generally what is going to be standard in different places. Or if you're going to start something on the truck, I would surely suggest that you would use 16 mics in ml. That's what's going to be in the ED and ICU. So set your dose up. We're going to start off at 5 mics a minute. And for safety measures, we're just going to put in 250, which is probably what your bag's going to be. Hit start, and it will be good to go. So if you do need to go modify this you will hit channel. It's going to pull up your dosing menu. You go in and increase or decrease your rate as you need. Hit start. That will just restart with the new rate. The next medication we're going to discuss will be epinephrine. Go through guardrails, hit the A through E section, then hit E. That's going to pull up all your medications with E in them. We're using the non-weight based. You have two selections, either 10 mics or 20 mics in ml. Most of what you're going to see is going to be 10 mics in ml out there. It's going to pull up your dosing menu, hit next, or your concentration menu, then it will take you to your dosing menu. Type in 5 mics a minute. You want to put in how much is in your bag minus a couple milliliters to be on the safe side. You should be good. Hit start, and your infusion has begun for an epinephrine drip. Next on the discussion is going to be setting up a standard drip without any guardrails at all, and the pump has no idea what you're running through it. It has nothing to help you with checks and balance, and we're just going to basically be setting in a standard rate. For this, we're going to use 125 milliliters an hour. You'll just punch in 125 milliliters an hour, punch in how much fluid you want to give. As a backup, we're going to give 1,000 milliliters or a liter. Hit start, and your infusion will begin. Now this you could also use if you have certain medications that you know that you're not going to titrate. It's already got a set hourly rate in the referring physicians or referring facilities pump. I don't recommend using this method for starting certain drips, but there are some that it just may be easier to do like this. You can just use good solid judgment on this. Now we're going to go over how to set up a normal saline infusion through using the guardrails IV fluid section. Thumb down, find the appropriate fluid that you're after. And as you see, right before we had half normal saline with K riders, and you still have normal saline and K riders in this one also. So you will set your rate, and if you want to set a duration, you can do that as well. We're just going to set how much we're going to put in, be our maximum fluid amount. Going to go with 500, and we're going to run it in over 20 minutes. It's probably not going to take it because that is going to exceed, and it did not take it. It exceeded the pump's ability, because again, pump's ability is 999. Going to go in and back up. If you're easy math, if you're putting in 500 milliliters and needs to go in as a bolus rate, the fastest it's going to go in is going to be 30 minutes. We'll punch in 40 minutes, 45. Hit enter. You can do it. Hit the enter button. Hit the enter button. No, you're just going to go for the start button. There you go. So now it's started. And that is how you're going to run normal saline through the guardrail system if you so desire.